Question about, you put a letter there that we could sign a letter to increase funding for gastric cancer. And one of the things I thought, I would like to find out where I could get that letter. And one of the things why this is really important, as you might know, NIH funding for gastric cancer is less than 1%. This is actually was put out by the Gregoria Foundation, Family Foundation. It's less than 1%. So it would be nice to sign that letter. I don't know where I would find that.
Yeah, so we'll send it. You guys have all the emails, so we'll send it out to people to sign and send to your own, representatives in your district. I think that would be more powerful than sending it to one person. Yes, please.
Beach and we're from Kaiser Permanente in Southern California. Yeah, I think I echo that sentiment that one of the main challenges is the funding environment, not just from NIH, but other societies, philanthropy, other areas. And I wonder if our panelists have any comments. Was there concerns or resistance? Because I didn't see in that bill that there was any call for specific funding. And then, where are all the donors as far as trying to support research in this area?
I think the donors, you have to go find ourselves, right? So the grateful patients. So not for the rare cancers groups, the foundations, not just the NIH, but there is money in the moonshot. It's just not coming to gastric cancer, and we're trying to figure out how to get that by advocating for that, right? So the DoD, the reason the DoD, the CMC, I think, the way they got gastric cancer was through advocacy. So that put money into gastric cancer specific research. So it seems like we have to do a lot of legwork to just get a little bit. The funding from patient, I think CARE is very lucky at Stanford to have, private donors and foundation support. That's probably something that we need to do more of for gastric cancer trials.
Often it makes a difference if a donor has a personal relationship. So that's also something else for you all as clinicians to think about in talking to your patients. Like, how can they also get engaged? The other thing, there's been so much talk about colon cancer. One big shift happened when Katie Couric's husband died of colon cancer at a very young age. Well, she was like the morning anchor on the Today Show or whatever show it was in the morning, one of the most watched shows in all of the United States. And she became a huge champion for colon cancer prevention. And I think that made a huge difference. So to have people who are very well known, very well recognized, and who can become spokespeople can also make a big difference.
Also, if you don't ask, you don't get it. So you have to sort of learn how to ask, and it's very hard for doctors to do that.
I just wanted to bring another point. Stomach cancer is one of disparities, and typically they're really, and it's not one of those cancers that is like, it's something that people want to hide. It's cultural, like a lot of Asian people. My father wanted to hide it, so it's really difficult to find somebody willing to be a spokesperson on that front and to raise awareness.
Kathy, I want to thank you for all your efforts since we've engaged you. I mean, I think that you've made a huge difference on the federal side, and Aki, especially for all the work that you do for advocacy. I mean, this is really, we involve you here at the summit mainly because we don't do this well, right? This is one area of academics that we don't actually like to engage in for some reason. And so we definitely depend on you. I want to know, now that you've been involved with us for a few years and, have a good idea of the landscape and what our needs are, what is your advice in terms of engaging the federal government, and what are some short-term victories? I'm all about, you have to have a long-term vision, obviously, but, you have to have some short-term goals that are achievable. Otherwise, you don't get anywhere. So what are some short-term achievable goals that we can work together to pursue?
Do you want to start?
Yeah. Well, so in DC, they say that there are two ways of success. One is money. Money always talks, or it's boots on the ground. And the more people that you can engage and organize into a broader and broader coalition, the stronger the voice. So yes, this meeting is about gastric cancer, but just as we had talked about, just at the panel before, right? So you do an upper gastric endoscopy, and you can find other lesions. You can find other kinds of cancer. Well, how do you start bringing together all those different kinds of cancers to then push forward? Because then each one might be rare, and together they still might be a small percentage, but how do you amass more voices and efforts together?
So I think, for me, I think it's the patients. First of all, I did the Patient Empowerment Summit. That was my bread and butter. So that was a whole weekend of educating patients on treatment options and survivorship and navigating their cancer and mental health and community. And then I said, hey, while you're here, why don't you also advocate, here's the disparities in stomach cancer, and help find somebody, help resonate your story with somebody so that this doesn't happen to somebody else. I will say about half the people who were at the Patient Empowerment Summit, of roughly around 100 people, 50 people stayed to do the advocacy day.
Huge.
And they went, and we did not have an ask. We just said, here's the disparities, here are the problems. You're the lawmakers, you find the solution to this. And so I was blown away by the outpouring of love that I've received from a lot of different Congress people. Usually, I've done this, I've advocated on the Hill for a lot of different other groups for a very long time, and this was my first time where I was getting emails from the congressional staff saying, thank you, we have some ideas.
It sounds like what we need to do is coordinate with that, because you have the patient stories and we have the ask, right? And I think that it would be great to join forces and get some more physicians and researchers who say, hey, we can address this problem, but we need some help from you guys. And so maybe that's a great short-term project to work on, to somehow coordinate something in DC, and we'll get you some physicians and researchers to help you with the engagement with Congress.
Yeah.
We'd appreciate that. We're going to be there February 11th, so the Patient Empowerment Summit is a few days before, and then February 11th is when we're on the Hill.
And do you do a training the day before?
Yeah.
Yeah.
We do a training, but it's just other patients that share their stories. I mean, Lauren did an advocacy day. Sorry for putting you on the spot, but you were part of our advocacy day last year.
I really enjoyed it a lot. I feel like from a youth perspective, I think it's important that we educate more on the youth, because just like when I was lobbying in DC, I learned about a kid named Brayden who's diagnosed with stomach cancer at 11 years old. And I feel like as time goes on, it's only a matter of time where adolescents start getting diagnosed with stomach cancer. I think it's really important that we continue to mobilize these efforts to get awareness, get funding, so that we could perhaps almost find a cure or an efficient solution for it.
Sounds like the theme is everyone get together and work together to do what we are really, really good at: scientists, physicians, surgeons, and advocates. Is that right? And policymakers. Any last minute comments, Juha?
Appreciate everyone on this panel, and thank you for those presentations. So again.